Let's talk about anxiety disorders and anti-anxiety medications for a little bit. Um, Anxiety is a condition where the nervousness that we all have to some degree gets out of control and becomes a disorder, in that it becomes dysfunctional or disabling. Some people have what's called generalized anxiety disorder, where they just have a high degree of nervousness all the time. They have nervousness, they may have sweating, heart might be racing, their stomach may be upset, their mind is kind of frenzied, they just can't relax, they're tense. Other people may have out and out panic anxiety, where they have discrete episodes of panic attacks, where they have overwhelming anxiety, catastrophic anxiety, with hyperventilation, heart palpitations, an impending sense of doom, feels like they're going to die, like they're having a heart attack. They get pins and needle feelings in their hands and their feet, their mouth, which is a result of the hyperventilation and breathing off too much carbon dioxide too fast. And they're usually unprovoked, although in some individuals' cases they have what's called agoraphobia or agoraphobia with their panic anxiety, which is a fear of being in wide open spaces or being in crowds, and that triggers it. Some people have social phobia and are anxious in social situations, and others have specific phobias which causes their anxiety, like a fear of heights or a fear of spiders, a fear of snakes, things such as this. Sometimes people's anxiety is secondary. It's secondary to when they're depressed, or it's secondary to instability in their bipolar disorder. And then there's also medical conditions which may present with anxiety, like electrolyte, blood chemistry instability or imbalances, thyroid imbalances, hyperthyroidism, calcium level disturbances due to parathyroid gland abnormalities, a condition called mitral valve prolapse, which can give some heart irregularities, heart arrhythmias, and so there are some medical things that need to be worked up and checked into as well when there's anxiety. Of course, post-traumatic stress disorder, when someone's been traumatized, people will have a high degree of anxiety, may have panic attacks with it. They have difficulty relaxing, they have startle response, they have vigilance and scanning, they're looking for a danger, for the next trauma to come their way. People who have been abused physically, sexually, emotionally, people who have been in automobile accidents, people who have been raped, people who have been in war situations, just catastrophic anxiety. Maybe when someone has had a close loved one die suddenly, people who have been in car accidents and have had near-death experiences, drownings, different things such as this. When it comes to medications, there are the benzodiazepines, there are SSRI antidepressants, there are SNRI antidepressants, there is a medicine called buspirone or Buspar, and then there is hydroxyzine or Atarax. Those are the common ones. And there's also gabapentin, or Neurontin, or Lyrica, and pregabalin. And that covers the major anti-anxiety medications. If someone is depressed or someone is unstable in their bipolar disorder and their anxiety is secondary to those, then treatment of the depression or treatment of the bipolar disorder can go a long ways towards getting rid of their anxiety. The benzodiazepines work in the nervous system by facilitating the inhibitory neurotransmitter GABA, and cause a sense of relaxation or calmness in the nervous system. They're sedative medications, which can also be used as hypnotics for sleep. They have an abuse potential, and there are some potential problems with them because you can become addicted to them. But beyond that, they do have the potential to cause memory problems, and because of that, there are some studies that show that they interfere with psychotherapy. So when people are working on their anxiety through psychotherapy, they can interfere with the learning process that goes on in a psychotherapy experience. There's also some studies that show a potential long-term risk of dementia from the chronic use of benzodiazepines, which may make some sense from the standpoint of their causing memory problems. The memory problems are taken advantage of in surgical procedures in which certain pre-op medications are given to induce amnesia for the surgical procedure itself as part of the pre-op preparation. With the benzodiazepines, they're short-acting benzodiazepines like Ativan, or lorazepam is the generic, or short-acting Xanax or alprazolam. And then there are long-acting benzodiazepines such as clonazepam or Klonopin, or diazepam or Valium. And now there is a long-acting Xanax or alprazolam called Xanax XR or alprazolam ER extended release, or XR extended release. One of the problems with short-acting Xanax is that it's so short-acting that when it wears off, it precipitates rebound anxiety. As it's leaving a person's blood system, the rapidly falling blood level actually precipitates withdrawal anxiety, which then makes the person feel like their anxiety is escalating.